Hi, Leah. Welcome.
Good morning.
Yeah. Would you you take notes, right?
Yep, I'm going to take notes.
Thank you.
You're welcome.
Okay. Like I was saying, it's very interesting to see everyone. Everybody, you're welcome. And we would start the meeting now. This is the new normal, and we hope that it wouldn't last too long. What we have on our agenda today is we're going to have brief introductions, and people will just say their names and organizations. And I don't expect that should last. That should be more than a minute for everyone. Then for all of us, we would like to know what is happening in your various groups or organizations. So we would have those kind of reports. And like Ed said, when we finish the introductions, anyone who wants to give us a report would raise his hand, and Ed would know that, and he will call on people individually. And then what we would try to do is to, after the reports, we would have a critical assessment of the issues as far as COVID-19 is concerned with the communities that we work with. So that is going to be some kind of a discussion of what we think is going on, some of the critical issues we have seen going on, the concerns that we think people have that needs to be addressed, especially the refugee community. And the last item we have is to discuss the possibility of having a Facebook Live with a panel with some of you who are in strategic positions or people who actually have things that would like to share with the community. So that is one thing we're going to discuss as the last item. And then if people have announcements, we can make announcements at the end. So I will hand over to Ed.
Okay. Hey, thanks, Sunday. Actually, it's really great to see all your faces. We don't see a lot of faces where, well, some of us don't. And then those that are out and working, thank you for what you're doing. Before we start again, what I'd like to do is, if you could go to if you're on a computer, go to the bottom of the screen and click on participants. And then once you've done that, you'll see a list of participants on the screen. And then what I'll do is I'll just go down the list. They're in alphabetical order by first name. And then we'll just do a quick, give us your name and who you're with. Once we've done that, we'll turn it back over to Sunday, and then we'll get into more details for the meeting. So, and then also, if you're at also at the top of the screen, you can see speaker view, or there's another name. I'm on speaker view. You know, you can go to speaker view or like a grid, so you can choose that. So my name's Ed Cranston, and I go to First Presbyterian Church, and so that's how I've gotten involved with the group. So let's go to Amy.
Hi, I'm Amy, and I'm with Parkview Church on the East Campus at the corner of Broadway and Cross Park, and we have an ELL class.
Great, thank you. Hyman?
Hi, I'm Sharif, and I'm with Global Food Project of Iowa City, and we are growing food in the Johnson County Poor's Farm. We have suspended our activities for this summer due to COVID-19, but we're looking forward for more work with our groups.
Great, welcome, welcome. Craig?
Yeah, Craig Welt, and like Amy, with Parkview Church East Campus and the ELL program, and we're running just one online class at this time.
Okay, great, welcome. Daisy?
Hi, I'm Daisy. I'm the Community Outreach Assistant for the Iowa City Police Department. Travis and I are on this call together just to kind of get a feel for what's going on in the community right now and what we can help with.
Hey, welcome, thanks. Peggy?
Hi, I'm Peggy Linden. I'm the K-PACE Pathway Navigator. K-PACE is a program at Kirkwood in Iowa City.
Sunday, I'll go to you. You're next on the list.
Okay. My name is Sunday, and I am on the board of IC Compassion, and I work for Systems Unlimited too.
Great, thank you.
I do as
let's see.
well.
Yeah, Wangui?
Hi, everyone. My name is Wangui.
Wangui.
I coordinate NISA African Family Services. We work with survivors of domestic violence, sexual assault, stalking violence, and human trafficking with people, with African refugees and immigrants.
Welcome.
Thank
Andy?
you.
I'm Andy Coghill-Barons. I'm with Neighborhood Centers of Johnson County, primarily located on at our Broadway Center on the southeast side of Iowa City.
Okay. As we're going through the names, welcome. As we're going through the names, they seem to be shifting. So I was hoping to go down the list. So if I miss somebody, if I say your name again, my apologies. So let's see. Joan.
Hi, I'm Joan Vandenberg. I'm with the Iowa City Community School District.
Welcome. And Kate.
Hi, Kate Klefstad. I'm with Johnson County Public Health. I manage the clinic, which has the WIC program and maternal, child, adolescent health and family planning.
And Kelly?
Okay, you can hear me?
Yes.
Yes.
Okay, hi, I'm Kelly Schneider. I am the Johnson County Mobility Coordinator. So I help people get connected with transportation. As far as transportation is concerned, both Coralville, Iowa City are running a Saturday service, so their service is limited, but there is still service. The service is free right now. I'm not exactly sure how much longer it will be free, but I will definitely notify the group when they start taking fares again. So,
Great, welcome.
thank you.
Leah?
Hi, my name is Leah, and I am at IC Compassion, and I'm an AmeriCorps member, and I take notes for these meetings.
Hey, thank you, and thank you for the invitation.
Yeah, you're welcome.
Casey?
Hi, I'm McKenna, and I am doing a practicum with the Iowa City Community School District this summer.
Welcome. Michael Shaw?
Hi, I'm Michael Shaw. I'm the student family advocate at Lucas Elementary and Shimmick Elementary.
Welcome. Officer Travis?
Hello, I'm Officer Travis Neal, work for the City of Iowa City Police Department. I'm the Community Relations Outreach Coordinator. I work with Daisy and look forward to getting to know all of you over the course of the next couple of years.
Great, welcome. Wendy?
Hi, I'm Wendy Ford, and I also work at the city in economic development. And so my role has been to try and help find ways that the city might be able to help people in the immigrant and refugee communities.
Hi, Julia, do you have access to audio? Okay, also then Marwa? Would you like to introduce yourself? Okay, so let me, before I turn it back over to Sunday, what I'm going to do is, actually we've been with so many people on, normally what I would do is mute everyone, and then you would just unmute yourself if you'd like to say something. So if you'd like to just go ahead and mute yourself, unless you want to say something, that might be handy in case there's background noise. And then also, if you would like to say something, look at the bottom of that part. For those of you that may have come on later, click on participants at the bottom of the screen. And once you see that, at the bottom of that screen, it'll say raise hand. So if you'd like to raise your hand and contribute, then Cindy can call on you, or I can get to you as well. So before we move on, I do see we do have, there's someone came in by phone. If they would like to introduce themselves and say hello. It's the 319-359-8064 number. If not, welcome. Okay, Sunday, if you'd like to take it over.
Oh, one quick thing, we forgot Elizabeth. Elizabeth.
Oh, Elizabeth.
Herself.
I did say the names are kind of moving around there. So sorry. Let's see. Let me just a second. I want to highlight you here.
Thank you.
I can't find you. There you go. Oh, you're right up here. I'm going to spotlight video you. You're on. Go ahead.
Thank you. My name is Elizabeth Bernal, and I'm working at the school district, Iowa City, as a culture liaison. And that's it. That's what I have. Thank you.
Welcome, Elizabeth, and sorry I missed you.
No, you're fine. Thank you.
Okay, anyone else? Okay, Sunday.
Okay. Again, I would like to welcome everyone and thank you so much for taking the time to attend this meeting. I think that it's critical because we haven't met for some time, and perhaps this is the only avenue that we can actually meet and discuss what is happening. I think that Ed, you're still going to go on and probably have people raise hand to give us some kind of an update on what is happening in their various areas, either offices or the areas they are working. So what we want to do is to just take an update from people generally. So maybe people would do that by raising their hands, and then you call and.
Okay, I'll look on the participants. So if you, I actually would like to hear from everyone kind of what your organization is up to.
Yeah.
So I would like to see a whole lot of hands go up real soon. Okay. And again, how you get there is go to participants. And then at the bottom of that screen, just click on raise hand. Okay, so now I only see a couple hands up, so yeah, great. I'll go ahead and start down the list here. And Joan, would you like to start?
Sure, I'd be happy to start. So as I mentioned, I'm with the Iowa City Community School District, and we have a lot going on during this really interesting time. First of all, we have food distribution sites that everyone should be aware of. It's on our website. They will continue through the summer, although once we're through the actual school year, those will change a little bit. But to date, I think we've served over 200,000 meals. So it's been, I would say, a big success, and hopefully I work on the meal site, and there's a lot of food that we give out each day to kids, both a breakfast and a lunch. Our buildings are closed to everybody through the 4th of July. So even if I want to go into my office and get something, I have to seek permission to do so. So that means that we won't be offering any in-person programming in the month of June. And then I would say right now, the biggest focus in the after school or in the school district is the return to learn plan. And that's what, Governor Reynolds is asking our district to develop a plan of what school will look like in the fall, which is going to get very interesting because there's either all virtual, all in person, or a combination of both, because we need to open schools with social distancing in mind. So I think there may be some opportunities to get your input in some of those planning committees, because I'm worried about our immigrant and refugee families, particularly when it comes to virtual learning and the technology involved with that. And I might kick this to Elizabeth to talk a little bit about what she's been doing to reach out to families who are not speaking English as their first language. Is that about what you wanted me to say, Ed?
That's perfect. That sounds
Okay.
real good. So,
all right, I could talk all morning, but.
So Elizabeth, I'm going to go ahead and would you like to add to Joan?
Yeah, thank you. Thank you, John. Yeah, we've been working a lot this time during this pandemic. It's really hard, especially to teach in the community, like Latino community. It's a little hard because we have some people that they don't know how to read or write it. So imagine that stress on top to added the technology, which is not really easy for nobody, but it also like the level of the understand Spanish and another language. So it's a lot of layers that they have to uncover. We have the language that we have to figure out if the parents, they understood the regulation or what they have to do with the technology. And some parents, they say, I don't know what you're talking about. Even if we told, like, if you go try to explain what is technology and what they can do, and they say, I don't know what to do. And Zoom meetings, right now it's a little crazy because we have to explain what it is. It's a video chat, we have to talk, and they say why we have to do it. So it's a lot of barriers that we have right now, especially with the technology. So I learned a lot from those kind of things that some people feel like really intimidated to be in the speak in video or Zoom. They just say, I don't want to do it. I don't feel comfortable. So it's a lot to understand because they say, I don't want to know, like everybody see my face. So it's, and for the students, we have some students that they just arrived United States. So they probably know a little, just very little understand the English and very little understand the technology. So it's another issue that we have after parents. Also the students, they have the same issue. They don't know, they use probably the phone, but a Chromebook is a little different than phone. So it's more easy in their phone, using their phone, the Chromebook. So and be working with them, it's a little hard because we have to explain to them, and sometimes they asking, even if you explain, I'm not going to use it. I have to have somebody with me so I can feel comfortable to use this. So this that's another kind of various thing that we cannot be with them, or they don't feel comfortable to use it. They feel, I have a parents that they say, and what's going on if I broke it or if I touch something that I'm not supposed to be touching. So it's a little intimidation and technology. So it's a huge issue with the families. Also, they don't understand at the first couple of weeks, what is the pandemic, what is the COVID. So COVID-19, we have to, even if you explain the language they use, some people outside, we have to check. For some people, double check 3 times because they don't know what's going on. What you guys talking? Why they stop my job? Why they thinking like probably they fire me? That they don't need me, and you have to kind of like explain again and again in different way until they understand what's going on in the community. So it's not only education; it's a lot the barriers around in the community, and later they start saying after 2, 3, 4 weeks, they even if you tell like you're able to apply for food stamp, they also they worry because they if they in process, they say, I don't want to be a public charge and this for me. I don't want to receive any money for government because I don't want to be better struggle and find my way than take any help for the government because it's public charge. And that it's gonna affect in my status of legal status and immigration. So it's been a little frustrated to the community trust what they can do, what they cannot do. So it's a challenge to explain, depends on the different type of the family. Some families, they are citizen and be here for a long time, but they don't know what's going on. And they don't know what is the resources outside because they've been working a lot most of the time. They don't know how to communicate with the teachers sending email with they don't know even that they have a student family advocate in each school. So it been a little, we have a little bit of everything. So that's pretty much what I've been working, given the resources and the community has, sending people to IC Compassion to do the pantry food, crisis center, giving information for assistant rents for the worker center. So it's been a little challenge that we having with people, assisting with the rent, assisting with the food, some single moms that be here with kids that they are not citizen, and they said, I cannot get any help. I don't know what to do. I don't working. So it's a lot of stress in everybody. So I giving up as much as I can to give the resources. So whatever I know, if I know, I can ask and send emails and check to myself and make sure it's safe and secure for the family, so they can trust and not be on trust on that way, because building the trust is kind of be a little hard. So right now I see that people, I don't have to contact them. Sometimes they call me and say, hey, I need this. Now I feel more like, I have a family that they say, my mom just got sick and I don't know where to go, what to do. And I kind of, and by the phone, I just say, you can do this and this and this. So just try to teaching them what they can do and try to figure out. And because they don't want to be in that position, give the name or who they are, they just want to be quiet. So it's another issue also that they don't want to say that they sick because they don't have health insurance, and they're scared to be going to the doctor, or where they don't know where to go with the doctor issue. So it'd be a little crazy in that issue, because they say that they don't trust to go to the doctor because they don't want also to pay the bill, taking the test for COVID-19. So it's that one, it was a little hard for me to try to explain that it's okay to go, but it's been a little chaos and healthy issue, because I know a couple families that they don't want to go to see any doctor because they don't want to have the stress to pay that bill, because they don't know the amount or how they can work. So it's been a little kind of like chaos to understand what is exactly COVID-19. And I think for me, that's it what I have, John. I don't know if you want me to add something else.
No, that's great, Elizabeth. And I think you all can appreciate how hard Elizabeth works to bridge between the community and our Latino community. So thank you, Elizabeth.
Absolutely, lots of challenges, and thanks a lot, Elizabeth, for helping deal with those. So I'll go ahead. Let's go to Andy, and I'll go ahead and unmute you if I can. Maybe I can't. Take it away, Andy.
Thanks, Ed. So Neighborhood Centers of Johnson County, our school age programs have not been meeting since mid-March, spring break. We have made the decision not to hold programs this summer, just to at least give families some sense of certainty for what the summer is going to hold for them, so they can make plans. Our early childhood programs closed mid-April due to lack of demand. We saw our numbers plummet from 90-some kids a day to 3 to 5 kids a day. So we made the decision to close those programs. Our family support workers are still working with families. We are doing teleconferencing or video conferencing with all of our families, trying to keep them connected to resources as we're able. We are doing food and diaper drives, looking for diapers and rice and beans and pasta sauce, staples like that, that we are able to then distribute to families. One of the things that we are seeing is that families are, while they're definitely struggling with rent and utilities, there are some programs that are available through United Way or LIHEAP that are able to help. But fresh produce is what families are having trouble accessing right now. So that's one thing that we really can't store on site for them for distribution. So that's where our families are right now.
Okay, thanks, Andy. Let's go to Kelly, if you could unmute yourself.
Sure. Okay. I just wanted to get back on. I kind of said in the beginning there that as far as transportation is concerned, public transit is still running. There's a few volunteer programs that are not operating right now. So the American Cancer Society for cancer patients to get to their care, and then also the United Way's RSVP program, which is for seniors volunteering. So I am working with some different patients and people that still need to get from point A to point B. So it's been kind of a little bit of calling around to see who can still provide services. So as far as my particular services, I'm doing working from home mostly. I am still helping clients. I'm just not doing any active travel training at this time since transit is reduced to essential purposes only. So as I mentioned, the systems, public transit systems are still running. They just have a reduced schedule at this time. So that's really all I wanted to share.
Okay, thanks a lot. Eamon, I'll go ahead and if you can unmute yourself.
Sure thing.
Go ahead, thank you.
Yeah, I just wanted to share with everyone what we've been doing is at Global Food Project of Iowa City is getting the people of Iowa City, the new immigrants and the Iowans to meet together over gardening or agriculture, because we have the strong belief that people know each other best when they work together in cooperative activities and endeavors. We have been growing food in the Johnson County Poor Farm since 2016. This is obviously the time we meet outside is during this time, the springtime. And we did this in the spring of 2016, 17, and 17, 18, and 19. We were not able to do it this time due to the concerns over coronavirus, because we have the families coming out, including the children, and sharing hand tools, and all of those things were just like really concerning. So we decided not to continue with our activities for this year. But we also figured that we will use the time to prepare ourselves for a strong comeback again next year, while also figuring out the best way to deal with COVID-19 and uncertainty, because apparently this is a time where the community need more confidence and more trust rather than the uncertainty which is happening now and the fear. So we'll continue working with our City Compassion and other groups to try and figure out the best way to prepare for a strong 2021. This is what we've been doing. Yeah, if you have any question, I'm happy to answer as well.
Hey, thanks a lot, appreciate it. Let's go to Peggy, if you could unmute yourself.
Yeah, as you guys probably know, just like the other schools, Kirkwood's buildings are all closed, so staff are all working from home. Kirkwood has also been operating a food pantry on main campus, a pickup on Wednesdays. And if anybody wants more info on that, I can let you know. The K-PACE classes were interrupted this spring, right, at spring break time. So we're hopeful that we can get those students into, the appropriate classes that they would have taken this spring. We're gonna do what we can to put them into the next ones that are available. Kirkwood is planning a phased return of staff and then students. So we're still kind of in the planning stages of what fall might look like. Honestly, not quite sure what that will be, but we'll let everybody know when we have some news about that.
Okay, great. Thanks, Peggy. Thanks for the update. Let's go to Michael. If you could unmute yourself.
Yes. Yeah, I was, actually, I just wanted to, I guess, like, piggyback on top of what Elizabeth was sharing in a way of looking into the future. The technology is going to be a significant concern, based on what Elizabeth was talking about, because if we don't end up back in the buildings with education in Iowa City School District, we're going to be doing, it's likely to be required virtual education, where students are going to have to be there. And that's going to be a significant issue for families, as Elizabeth was talking about, that are needing to learn the technology. And that might be something that it would be good for the community to be paying attention to over the summer to get families prepared for that.
Okay, thanks, Michael. Let's go to Kate. If you could unmute yourself, Kate.
Sure, thank you. I just wanted to quickly mention, I mentioned in my introduction that we have the WIC program here in Johnson County Clinical Services, and we are continuing our WIC services. Our buildings are also closed through June 8th, but WIC at the federal level has waived the need to have a physical presence with any clients, new or existing, and so we're able to do all of our visits by phone. And our participation has spiked pretty significantly as people are needing those services. So just wanted to let this group know that all of those services are being provided in a safe, socially distant way. We're able to get new clients into the program that way as well. WIC benefits are distributed via a card, kind of similar to a credit card that you use in a store, and we can send those via the mail, or people can stop and we'll run them out curbside. But the visit itself is done remotely. And so just want to get the word out to anybody who's needing that. For those who are concerned with public charge, WIC is not included in public charge. And I know that for some folks that's not enough of a, that's not reassuring enough, which I understand. But as far as that goes, we according to the way the policy is written now, it's not included, and so people can feel safe in utilizing those services. And then just one more quick note, we are in the process of building a family planning clinic with Title X funds. So that's family planning and reproductive health services for low income and folks who don't have the ability to pay or don't have access to those services. That'll be coming likely mid-July. And so more info to come on that, but that's something that will hopefully be a service that's utilized a lot by this community. I think right now, without any Title X funding coming into this county, there's not anywhere for anyone to go for like free contraceptives and pregnancy testing and STD testing and that kind of thing. And so we'll be able to provide those services at no or low cost to low income folks. That's everything I have.
Hey, thanks, Kate. Good information. Would anyone else like to share what they're up to? Also, one thing I did not mention is that if you're on a computer, at the bottom of the screen, also click on chat. If you click on chat, you can make a comment. Then also, I noticed on the chat that Kelly has shown some information there. So if you'd like to find out more information about the local transportation, thanks for sharing that, Kelly. So I'll turn it back to you, Sunday.
Thanks, Ed, and thanks everyone for sharing. And it seems like all of us have been very busy, even though online and remotely. But I think it's gladdening to know that people are actually doing their work and trying their best to see that we reach this community that is of concern to us. The next thing I want us to do is to actually come out. There are quite a number of issues have been raised, especially when you listen to the reports from the school district, I realized that there are quite a number of issues with some of the families that we are concerned with in terms of communication, especially with technology. But also one of the things that I know is as some of the schools try to reach out to students with various technologies, even at the homes front, there's a problem. So the disparity is still there in terms of the response of people to some of the technologies that are being used by the schools. And so what I want us to do is actually go try to see if we can identify some of those critical issues that we have seen. And when we identify them and list them, then we would know how to handle them. So it's possible that in the course of this discussion, we've mentioned some of them, but I think that it's better for us to be actually come out with them concretely and say these are some of the critical, whether it's about food or it's about education generally, or some of the people who are running small businesses. All of these are issues that I know are there. So I have it as an item on the agenda of outlining critical issues in the community that we need to address. So do I turn it back to Ed again and see if anybody wants to do that? You raise your hand and make a contribution so that Leah can be taking notes of the issues that people come out with.
So yes, if you would like to raise your hand electronically, feel free to do that. Or if you just want to go ahead and actually speak up at this point, I think everyone's been kind of, we have a nice quiet area here. So if you want to just go ahead and unmute yourself and share, please do that.
And let me just add too that if you have questions to any of the contributors, the earlier contributors, you can actually ask questions at this point. So if you have any question for people, whether people in the school district or the neighborhood centers or transportation or Kirkwood Community College or the Johnson County Clinical Services, in terms of what they have shared, please go ahead and ask those questions.
Hi, I think Ed, you didn't see my hand up.
Oh, I do not see your hand. Okay, I see it now. It's a physical hand. I didn't see the electronic one, so go ahead.
Yeah, I'll go ahead and I'll start by congratulating Ayman. Congratulations on your graduation with your master's in urban planning. I am blessed I was a part of your journey. So congratulations.
Thank you.
And I also want to recognize Daisy and Travis. I am glad you made it to the meeting. And then I'll go ahead and share and state that NISA is still working. Although we do not, our office is not open on Eastdale Plaza above DOT. We are working virtually through the phone, through Zoom and through phones technology. And for us, it has been more overwhelming because as if people have noted, the domestic violence has gone up with the COVID-19. And I have been working with a lot of you, especially looking for rent and housing assistance for survivors who have been thrown out by their partners. And actually some time back, maybe 3 weeks ago, we actually had a case on 5th Avenue. The fight was actually out on the street, outside the police station. The perpetrator, I don't know whether he was aware he was outside a police station or he wasn't, but yeah, they have gone up. And sometimes we have even had to wear protective gear and actually visit our clients. I'm thinking of some clients where we even have to deliver food. We have had to deliver toilet paper. We have had to deliver things like vacuum cleaners. So we are working and we are busy because the cases have gone up, mainly because people have been quarantined with abusers, or they have had to return because they've lost work. And right now I have a client who is in our city who is caught between a hard place and a rock. She works for Tyson, Columbus Junction. At first with the COVID-19, she had gone to run her daycare, but now with the CDC requirements, she is overwhelmed. So she's telling me, Wangui, I will just go back to Tyson because I'm not able to meet the CDC requirements and I cannot just handle the liability. So it's fighting COVID at the plant, or having to face the liability of looking after people's children. So what I'm saying is, yes, NISA, we're working, but it's very, very challenging right now. And we continue, but it's always good for a meeting like this to know that as we work, we have all of you here to help us as we work with immigrants, as our clients work at Tyson, they work at Tema, they work at JBS in Ottawa. And we already know some people who are already positive with COVID. And then there are people who they have to receive resources, they have to worry about being public charge. And at the same time, all of them are on the spectrum on the path to citizenship, and a lot of immigration work has halted. So it's challenging. So it's good to come to a meeting like this and kind of have you give me a few minutes and listen to me talk about it, because it does help with, and some of it is also traumatizing when somebody tells me I have to either go back to the factory, or it's vicariously, it's traumatizing. So it's good that I really appreciate our meetings where, if nothing else, I get a few minutes and somebody listens to me as I talk about all this. Yeah, we are open, although not open, we are working.
Thanks so much, Wangui, and and for giving us an update on NISA. Thank you. Joan?
Oh, am I unmuted?
You are unmuted.
Can hear
Go
you.
ahead.
Oh, okay, good. I'm really glad that Wangui shared that, because that was actually going to be a question that I had for her, is that I think one of the critical needs that I see is just the isolation, even the isolation among us providers. You know, I think that we're used to having more opportunities to collaborate in person and share. So when Sunday asked about critical needs, I would say, for me, social isolation, both in terms of domestic violence, but also child abuse. I think that isolation is just a huge risk factor for both those things. So that's a big critical issue that I see. A second one that I see is just basic needs. You know, are our families getting food, shelter, and healthcare? You know, and just how, you know, are the resources coming together for that? And then the third thing I would say is just technology, because that's kind of related to isolation, because if people have some technology, that might help reduce that a little bit if they know how to manage that. So anyway, those are just, as I was listening to everyone discuss, those are the three things that came to my mind, but that's just me. I'd be eager to hear what other people have to say.
Thanks a lot, Joan. Let's go to Officer Nude.
Yeah, I just wanted to touch on what Wangui said, and thank you for mentioning the domestic violence. It has increased significantly. We're seeing an uptick in that. We're also seeing a pretty big uptick in mental health. We're getting a lot more mental health calls. Providers are doing what they can with the Zoom meetings, but they're just not having a good enough effect. So the sooner we can get the people who are needing that face-to-face confrontation with their psychologist, their therapist, whomever it is, they're really lacking and they're really struggling. So that's something that law enforcement has seen a huge uptick in. We've changed the way we've done pretty much everything. I've actually been reassigned back to patrol. So I'm back on the front lines with patrol again, as opposed to my community relations position. And it's a real thing. The isolation has caused a lot of issues for us with that. It's also changing the way we're responding to things. We're doing things over the phone, which people are used to the providing of an officer showing up at their house and talking to them face to face. And we're not able to do that. We're not able to have those face-to-face conversations. So I hope people are understanding why we're not, but it's definitely changed the way we've done business as well. So.
Hey, thanks a lot. I'd say, are there other hands up? Anyone else would like to contribute?
Talking about mental health, I just wanted to, especially John and those people who are in the school district, I am glad to just let the Alliance know that my daughter has been offered a job as a school counselor at Iowa City, at City High School. And to me, personally, that is good. She's come home, but at the same time, she's also an alumni. But at the same time, this is also good for the Alliance and also somebody joining, working. She has always volunteered with NISA and also having more mental health people working. This is not me looking at her now as my daughter, but as a school counselor, working with the refugee community and also the cultural competency piece and linguistic piece with the immigrant community. I didn't invite her to this meeting today because she's also having a challenge that many of us who are working mothers are having, worrying about what do I do? I need to work, I want to work, but at the same time, she has a new baby, 3 months, a brand new grandmom. So having to figure out babysitting and childcare in the COVID context. So this is good for me because it's personal, but I also get to empathize more with my clients and others who are having to deal with going back to work as a school counselor, as they're supposed to, Iowa City, they're supposed to be going back on July 1. And also figuring out those who are working. And those are a lot of the challenges also my own clients are facing. You have to go to work, and what do you do with your children? Do you have a sitter come in, or do you take them to childcare? And what do you do? And the moment I also even start talking about that, even with my own grandchild, it becomes very, very challenging. And having to, my own youngest is 20 now. So I didn't personally, for a very long time, I haven't had to deal with childcare. But now, having a grandchild and having to think about that, I would want to hear a word of those of us who are in this alliance and kind of share a little of how you're going about childcare.
Thank you, Wangui. Anyone want to contribute there before we go to Michael?
So I can jump in a little bit. Organized, like childcare centers are having a really hard time staying open just because financially, even though the state has provided quite a few incentives for us to stay open, it's not making sense financially. We were running in the red even with the state incentives. So a lot of our families are relying on family or friend care to take care of children when they have to go back to work. We have families who used to have their children in childcare centers who are now working staggered schedules instead of working the same schedule so that they can not need to use childcare. Unfortunately, the families who are using friend and family care are seeing that the COVID-19 virus is kind of creeping into their inner circle. And so we have quite a few families who are not working, making that conscious decision not to work so that they aren't sending their child someplace that they feel is not safe. So the childcare situation right now is pretty dire. And I think that is going to be, we're currently looking at, we're surveying our families and seeing what their current childcare needs are, so that we could potentially reopen our centers. But with the guidelines that we are being told we're going to have to live with, it would be 8 children and 2 staff per classroom. So we wouldn't even be able to open at half capacity. And at that ratio, we would not be in the black. We would be in the red again. So we're weighing our responsibility to families and to children and our bottom line at the same time. So I'm sure that other early childhood centers are going through the same things we are.
Thanks, Andy. Anyone else? Okay, let's go to Michael. Michael, if you could unmute yourself.
Yeah, it takes me a little bit to get my cursor to find the right button.
Hey, no problem.
Actually, I had 2 questions for Kate. Kate, you're at Johnson County Public Health, correct?
Yep.
The one is related to Johnson County Public Health. Being part of the COVID-19 testing or response process that with the university, are you coordinating with the university there in terms of testing for families, or is that something? And the other question I had was related to immunization. This past year, our school district had the big push to get immunizations done for all of our families. They finally kind of decided to fully engage with the guidelines related to immunization for families. And my understanding is that there's not going to be any relief related to that because of COVID-19. So I was wondering how Johnson County Public Health is responding or would want us to respond to getting families connected to immunization. If you have any thoughts about that.
Yeah, great question. So your first question on testing, the local health department here, we have our response team. We don't do any testing ourselves, and we don't coordinate any testing ourselves, and we don't have, the state has put out those Test Iowa sites. We don't have any of those in Johnson County. So any testing being done here is related to, sometimes the state has come in and, for instance, done some testing in at Tyson's, which of course is not here in Johnson County, but they've done some kind of large testing in more kind of congregate settings or settings where there's kind of some masses of people. Otherwise, the testing here has been done mostly in kind of private settings, long-term care, or at people's providers. So we're not involved in that, but we do all the follow-up for any positive test in Johnson County. Our staff are the ones who connect individually with each of those folks and give them guidance and do contact tracing and things like that. So I'll let that be it for that, unless you have additional questions, and then I'll answer your question about immunizations. Immunizations, we, in 2 ways, we deal with immunizations and are connected to the school district. So one, we do all of the immunization audits in the schools to audit for compliance, and we have an immunization program here where we actually provide immunizations. So we do both. We support the entities who are trying to make sure that their students, or we also do audits of childcares to make sure that they're compliant. And we do that because we're obligated by the state to do that. The state requires that we audit all childcares in schools in Johnson County. But we do have an immunization program as well, where we're trying to provide immunizations to any family. We provide immunizations to children and to refugees and new immigrants. So we do try to provide where needed. Your question, though, related to the relief, so to speak, due to COVID for vaccine compliance, we're a little bit of the middleman here. So the requirements are state law, and whether or not those will be adjusted for the new school year is up in the air. There hasn't been anything that I have seen that says that those will be relaxed at all. They've been the same for years. It's just the school has had has really been strict this last year in making sure that there's been compliance. And I know that that was hard for a lot of families, and we worked with the school to try to figure out how we could, especially those families that have a lot of barriers to getting their kiddos in for vaccines. We worked with the school to try to figure out how we could do that. Knowing that it might be the same level of requirement this coming year, regardless of virtual instruction, we are meeting with the school, the health coordinators and the Healthy Kids School-Based Clinic to try to figure out how we can support. We have a program during the summer, typically, called School Ready JOCO. That's a program for vulnerable low-income families who need to get all of the school requirements, vision screening, dental screening, vaccines, that kind of thing. And we bring kiddos through and we get them completely up to date, and we give them a little backpack full of school supplies. We're going to hopefully be able to provide that again. And I think it will be really, really important this year, because just as an aside, across the nation, immunization rates are dropping because for I think a lot of reasons, but there have been a lot of people deferring kind of that more preventive healthcare right now. And so there are a lot of folks falling behind in vaccine compliance, and that's a scary place to be in. So we want to make sure that people are getting the vaccines that they need. And so I would say more to come. I think it's a fantastic question. We don't have a ton of answers, but we are trying to figure out how we can make it as easy as possible for people to get them. And I should have mentioned, we're doing WIC by phone. We're also doing curbside immunizations. So we've been continuing our immunization clinic every week. On cold days, we were setting up in our parking garage stairwell because it was warm in there and clean, and our buildings are locked. So we're really trying to do that, and I'm open to suggestions, especially from those from the community or with the schools, ways that we might be effective at getting the word out and getting families fully vaccinated so they're prepared for school. But certainly in the works. And what I would say is just any ideas you have or people that you think that we should talk to outside of the folks that I've mentioned we're working with, just shoot that my direction. Definitely open to any of that. Thanks for the question.
Thank you.
Yeah, thanks, Kate, and thanks, Michael.
Yeah, can I think it's 10 o'clock, it's 11 o'clock, and some people are already leaving. What I want to do is to see how we can wrap up the meeting. I know there are probably people having questions, but I wouldn't want too many people to miss out on the discussions. And therefore, maybe if I'm able to come out with some kind of a summary of what I think should be the way forward, and then, I mean, if there are a few questions and people want to stay for 10, 20 minutes, I think we'll be fine with that. But what I have noticed is the word that comes to mind, which is one of the things we had at the planning meeting, is the word resilience. How are people responding? How are we going to, even post-COVID-19, how are we going to bounce back as a community? And I think that is very, very critical. Now, how are people adapting to the situation? And it looks like people are really struggling. We've not even talked about businesses, small businesses, but people have brought up issues of trust, confidence, fear, the use of technology, and isolation as some of the critical issues that we're facing. What I would like to suggest is, it looks like there's still need for us to get information out to people. There's a lot of information about COVID-19, what are the signs and what to do. And so much have been, but we have not been able to address as a community the issue of resilience. How do people cope up with all the issues, the mental issues, the domestic violence that we have mentioned here? I would like to suggest that if it is possible that we organize some kind of a live what do you call it? Facebook Live, so that we can have members of this team, of this group, come up and actually share some of the things that has to do with resilience, and how people to adapt to the critical situation we found ourselves in now. I am thinking of Officer Travis. It will be amazing if you can, if we can organize a Facebook Live and you can come out and talk to the community about some of the response in terms of what is happening in the community and how people can adopt and help strategies to adapt to some of the crisis they are facing. And I think we also need the school district to actually, John, if the school district can come out, especially with your cultural liaison and have the opportunity, and if we can open it to a wider audience so that people can listen to what is happening. The Johnson County Public Health, I know that you have been stressed over the period of time so much, you've done so much in giving out information to people. I would see a situation where you would discuss more about resilience in terms of response to some of the issues with COVID-19. That so it's not just information about what it is, how to respond, but how is the community going to bounce back as it relates to public health, as a public health issue. This is a major public health issue, and I think that you play a very important role in helping people to be able to get back. This is not just important for us as Refugee Alliance, but also I think for the whole community. So I think that Kirkwood Community College, people have depended on you for a lot of the English classes and some of the K-PACE programs that you have. Maybe people need some kind of reassurance. So I think what we need to do is probably to be able to communicate after this, and the neighborhood centers, NISA, we could organize another thing to another Facebook Live so that people can actually listen to you, talk to them, and give them information of the things that you do. So I think if you agree with me, there's a need for us to reach out, not just on information on COVID-19 specifically, but also how do we adapt and how do we bounce back as a community, even post COVID-19. That is the kind of the summary and kind of suggestion that I have, and we would just probably take another minute or two if there's any response to that, and we can follow up with emails on how to organize this if you agree with it, and then we plan to meet again.
Yeah, I have to go to my bosses and ask about Facebook Live videos, but Daisy and I are texting here as you're talking about this, and yeah, the police department would be, well, Daisy and I would be very happy to assist in that any way you think is best. What kind of overwhelming message are you looking for us to put out? Are you looking about the domestic violence that Wangui brought up, or are you talking about the way the police are going to respond specifically? What are you seeing, or what are you thinking would be most beneficial?
Well, I think that, and people can chip in with this, I think there's a lot of issues that have been brought up. The issue of trust, confidence, fear is all issues that are related to the community. And like you said, I mean, bringing in the police department would be amazing. But it's going to be it's going to be something that will be moderated if your department is willing to do it. So we will come out with a list of some of the issues that we think are really community related that your department specializes in, together with the police department, and ask questions, and you bring officers that you think you and some other people who would be able to respond to these questions and address the issues appropriately. That's just what I'm thinking. I don't have anything specific other than the things that have been discussed here.
I was just thinking about everything that you said, Sunday, and it seems like the theme is resiliency, and that there would be different topics that we have kind of a series of events. And when it comes to the social isolation and domestic violence, you know, Monsoon and maybe DBIP would be also good people to have at the table. And maybe, I think, because I think our audience are families, and like, even though we're physically isolated, there's ways to reach out and using some of those strategies. So I think that would be a really good one to start with. And I think just that, I think Aman mentioned something about fear. I think having that, build that trust to just say, here are the supports that are available to you, and reach out would be a great way to start. But, and then maybe the next theme would be basic needs, or the next need might be how you deal with childcare or technology. But I feel like there's a lot of content, and we need to kind of break it into pieces, perhaps.
I'll piggyback on John and Travis and what you've all said. Yeah, it's big, so it's not a one-time thing. It's if we could get to a point where we are able to do it, is it every 3 months? Is it every 1 month? And decide what topics are we going to tackle, resilience, or how are we going to be about it. Just the idea that we've put it out there, that we do it. On Women's International Women's Day, during the celebrations, I was given the opportunity to give a public address. And of course, I was biased more towards domestic violence. And I shared a platform with an officer from the Iowa City Police Department. And Daisy, you were there. Yep. You can bear me witness. It was the celebrations were brought together by the Refugee Association under Jean Paul. And we could not even answer all the questions from the community, both for the police department and for NISA, and people wanting to engage more at the community level on the day-to-day things that the community deals with, but also the celebrations, because it's not all problems. So it's not a one-time thing. Sunday, what you've suggested, because these are technology times and where we meet virtually, yes, we can start and decide on, do we start on resilience? Do we start on Daisy and Travis doing the community outreach you needed to, on letting the community know what your division, your unit does? Yeah, it's not a one-time thing. It's something that continues, and working with the school district and the community and with the marginalized communities. So what I'm saying in very, very many words, it's a beginning. Yeah.
Yeah, and as Wangui was saying, I was there at the event, and her and Captain Brotherton were fielding all sorts of questions. And I think maybe what could work would be maybe a type of basics video, just because based off of that, if we did a Facebook Live, I'm not sure if we'd even get to everyone's questions, and some people might not be available for when the video was happening. So maybe finding a happy medium where the material is given, but giving people an opportunity to digest all the information and then ask the questions. I think that could also be a different way. So something that might be pre-recorded.
So
go ahead.
Yeah, I was wondering, it sounds like there's the discussion is towards a series of conversations with the community on particular topics. And if we're looking at the summer and having about 12 weeks, because I always think in terms of the school district timeline, having about 12 weeks. So one of the things I was thinking about was there could be kind of a weekly series of conversations. And one of the questions I had is for Sunday, is your sense that Facebook is the best and broadest communication tool for immigrant and families that are refugees or don't have English as a first language? Is that a sense that Facebook is one of the better communication tools for them?
Yeah, I would say yes, and also because I think that we could actually hold the panelists would be on Zoom, and then we can broadcast it on Facebook Live. And this is because I think that Zoom has a chat forum where you can actually ask questions, but I think Facebook is more used by majority of the people in the community, and we would also have them to be able to join, more people to join. So in terms of outreach, I think we'll reach out more to people on Facebook while the discussions are on Zoom. We can broadcast it on Facebook and people will be asking questions on Facebook. The other aspect that you touched on is English as a first language. What we might have to do, if we're going to do that, is to find one or two people who are either going to interpret in French or in some other languages that would reach more people. We have many people, many languages that are spoken by refugees and immigrants in the community. So what we all need to do is just identify what languages we can reach out to more people and have interpreters who will be able to interpret some of the questions and responses to the questions. But yes, my assumption is that we'll reach more audience if we use Facebook Live.
Yeah, so that kind of the secondary to that is, does the community have the capacity, if there was like a series, a weekly series? I know Hani Al-Kaidi, John, you know him, he did a program for a while on public access TV where he talked about education issues in the district, and I think he did it monthly. Mm-hmm. But something that would be, does the community have the capacity to have a facilitator for once a week for 12 weeks to be able to facilitate those conversations with kind of experts in the community or providers in the community? Is that something that is possible? Because that would be the thing. If there's going to be a series of things, can someone or a group of people be able to keep that going to build the momentum so that people know what to look for?
Yeah, I think that is what the Refugee Alliance would have to discuss now. Ed has been our tech man in terms of Zooming, and I don't know if he'll be available weekly, but then I think there are people who will be able to help with the Zoom, and connecting to Facebook should not be a problem. What we will need to do is to find facilitators, a number of people who would be willing to facilitate, so that if someone is not there, someone else can come up. I'll be very happy to facilitate one or two or three of the sessions. And if you're available and you can facilitate, all we need to do is actually to get the questions ahead of time, so that if we have a panel, then the panelists know the kind of questions they are going to answer. And then we would wait for audience to have questions. And we just need a moderator for the question and answer session, and also with the facilitator, with the panelists.
Yeah, so I heard just in the conversation we had today, I heard 6 or 7 topics. Yeah. That, or maybe even more than that would be topics for this. So that's why I was wondering if there were facilitators for it. It could be a weekly conversation that happened at the same time.
That's a beautiful suggestion, unless someone thinks otherwise.
Yeah, I agree. It's something Michael
every week.
Saying,
that sounds like it'll be a great idea.
Really worth exploring.
Yeah. Thank you.
Yeah.
Thank you so much, Michael. Any other question or anything, or are we agreed on what Michael just summarized, and we would move forward? I think the planning committee would sit down and discuss that, and then we'll get back to everyone by email. Am I right, Ed?
Sounds good.
John, you're there.
Well, and I was thinking just as a next step, if we can agree on what our first topic should be, then we could maybe pilot this a little bit.
I totally agree with your suggestion on what the first topic should be. If Travis, Officer Travis can get back to us on what his department thinks, we would go with you first, Travis.
Well, I was going to just defer to Daisy. So before this whole thing happened, we were planning an outreach, and I'm not sure all of you are aware of the forum that Daisy, and I'm not taking any credit for this because this was Daisy 100%. Daisy had worked with Jean-Paul and several other groups and other individuals to get a forum together where it was police, law enforcement, and EMS, emergency medical services. And it was just going to be a generic information of what we do, why we do it, how we do it, and then making sure that we're explaining basic things, like from as simple as traffic stops to some basic traffic laws that are maybe different in different places, and just to provide some transparency. I had 3 topics for law enforcement. Domestic violence was one of the main ones. Traffic laws were the second one, with just basic information for what a traffic stop looks like, because that's the most common way you're gonna have law enforcement interaction, most likely. And then the third one was responding to abuse in the home or discipline questions. I had some wonderful questions about what constitutes discipline, and parents who are honestly afraid that any discipline they provide to their children is going to cause a complaint to DHS and get their kids taken away. I was shocked to hear some of the information from the people in the panel. So it was really enlightening to me. We started the process of working on that. I had started a PowerPoint presentation, which we were going to translate into Swahili. That was the language that was indicated to us that would be the most beneficial for the group that we had talked to originally. But then also the fire department was involved in that. They were going to provide information about when to call 911, why to call 911, what a fire response looks like in an emergency situation, some of the things they do, and then also EMS responding to things like a medical condition, or explaining that there's no cost associated and it's okay to call 911, and just kind of get rid of some of the misnomers and some of the false information that have been passed on. So Daisy, help me.
Yeah, so one of the things that we were looking at to help with the translation and making sure the information gets to the people that would like to read about it was getting the questions and a basic answer to the question down and giving it to the groups that we were partnered with, in the hopes that they would translate it and have sort of printouts available. I think just in general, if we do a series, it would be helpful to have the questions and an answer to kind of pair that with whatever video would be that week. So people kind of have an idea of what the discussion will be about, and it's in a format that they can understand. So if that's at all helpful, but I don't see it being a problem doing a video of this nature for the community. We would just kind of need to narrow down what we would need to talk about. And I guess who would broadcast it, because we want whatever account this is going to be streaming off of to be the one to have the right audience to begin with. So does the Refugee Alliance have a Facebook group or an account, or is there an idea of who would be streaming this?
We do have a Facebook account. And I think that, Ed, can you come in here?
Yeah, actually, we also have a YouTube account. And so what we've done when we've had speakers, we've recorded the meeting, then we put that out on that YouTube site. So that's what I could do with this meeting as well, if that's what we want to do, is I could take the recording, put it on that YouTube site, then Leah then could share that to everyone that was invited to this meeting, so that they have the URL to go just watch this presentation. Very similar thing could happen with any presentation we do, whether it's live on somewhere or if it's just there and available for people to take a look at. And so if we did put it on YouTube, then what that would be is everyone would have that URL. Anyone that had access to the internet could click on that and go watch it.
And what I like about Daisy's idea of having a presentation is that we could have it translated in different languages. Because I know, Elizabeth, you have a Facebook book page with your Latino community. We could have it in Spanish and put it out in that form. I know that the Congolese also have a YouTube station. So I think there are multiple ways we could get this out in the groups that people already already exist. I think once a week is probably pretty ambitious, especially if we're trying to get the word out to a lot of things. But, you know, because it seems like we could put together a really great program, but if people don't see it, then put a little bit more energy into making sure it gets out to the people who need to see it. So.
And the direction we are taking, I'm thinking for Travis and Daisy, the community outreach meeting that was supposed to happen in April. And for NISA, that was going to work very well because it was going to be part of the Sexual Assault Awareness Activism Month. I liked that we were going to get to work together on giving information on the domestic violence piece, especially from your units, from the police department point of view, so that because we always get accused, the NISA women, that all we like doing is taking our men folk and to jail. So this would work very well. It would be taking we wanted it was going to be a face-to-face gathering, but we are living in COVID times. We just move forward and take it virtually and in all those other ways, videos. And I also saw a man suggesting making sure we also have printed matter and also the translation to and interpretation to Swahili and French, which are the main languages, and Spanish, which are the main languages spoken by the immigrants and the refugee communities in Iowa City. This to start with. I know Michael, somebody having all the pieces, but I can see Refugee Alliance, we come in and present to ourselves what each of our organizations is doing. We are moving to the next level. Now we are moving what we share with each other. Now we are sharing with the community. Now we are not just messengers to the community, but directly we are sharing with them. And at some point, who knows, Cedar Falls, they have an African radio station. So who knows what, we might end up having an all-time where we are able to share and the community is also able to share with us. It's a start. And Daisy and Travis, it looks like you are the ones who are most prepared to share what you do with the community. And I know this because we had a sit down and we pulled in other groups from who work with immigrants, and you had already the Refugee Association with John Paul. You've been working with Dr. Ann Kitcher of the African Communities Network. And now you have a lot of other organizations that work with the refugees and immigrants. So if you agree, we can start with you. And I didn't hear you, Daisy and Travis, refusing to do that. Yeah. Yeah.
Well, you're not wrong.
Yeah.
We'd be more than willing to do it. We would just need to get the approval from our supervisor, just because some things have kind of changed. But given that that would be a virtual thing and we wouldn't really need to do too many things face to face, I can see it being a yes, but I'm not promising anything yet. But we definitely do have the materials to make some sort of presentation or video like this.
And we have some stuff that's already pre-printed in different languages, so it would be easy to distribute that. Some stuff from previous outreach things. That may be a really easy first step The biggest problem is going to be my schedule changed so much. It may be a lot more of the Daisy and a lot less of the Travis, which is fine with me. But I don't want to dump all the work on Daisy either. We'll take this. I work tomorrow, so I'm off today, sitting in my living room. But tomorrow I will go to the bosses too, and we'll both see if we can't sway them to letting us start working on this stuff again.
Yeah. And when it comes
Well,
to the violence, I think it's also important to include the other things we do, so not just community outreach wise. So I would really like to bring in Anne, because she is our victim coordinator. So it'd be good to know what other things that we can do for you other than like
Speak
put
up,
people
please.
away.
Yeah, I would be more than willing to help out because I know there's a huge need for victim outreach in all capacities. Like you said, Travis, there's an uptick in DV, mental health, and just to reach out and support and connect these victims with resources and, you know, just support them, you know, in every way that we can, you know. And Wangui, you and I have worked together too, and Monsoon, there's just so many resources that, you know, are out there. And like we all said, in these times of COVID, isolation that I've seen can really, you know, be detrimental to a situation. So yeah, I'm willing to help any way I can.
Okay, it seems like we are narrowing down to where we're starting. And Travis, are you on our mailing list, or one of you?
I believe so.
Okay.
I think we all are.
Yes, I did introduce them with Leah. I don't know. I think I copied you Sunday at that introduction. Yes, the short answer is yes, they are on our mailing list.
Okay. Well, I think that probably if we're going to coordinate this, we might not have to send it to the mailing list. We have to send it to you as individuals in terms of coordinating. After we have met as the planning committee, we would discuss, we would liaise with you and coordinate how we're going to start. And as to whether it's going to be weekly or every other week, we would also have to look at the feasibility of doing that at this moment. So I think we are all agreed on what we need. There are quite a number of good contributions. Eman has stressed the importance of printed materials and brochures that stays longer with the audience. Totally agree with that. Translated materials helps and message lasts longer as a read material. And I can help with needed Arabic translation. So if you need help with Arabic translation, Eman is there. He is willing to help with that. Michael said one issue that also might be good for law enforcement to address is coordination for intentional non-collaboration with ICE. And we have families that have chosen not to access food distribution programs because of the fear of compromising their immigration status, even if unjustified. I think these are critical issues that sometimes, and these are coming from the chat group that people are writing on. And I think this is very, very good information. I don't think we should take this meeting longer than this. I wish we could, but we're hoping that we'll hold this formal meeting again at the end of June. Before then, hopefully we would have had one or two sessions of the live chat that we are planning, whatever form that is going to be. I think we'll try and agree with the people who are going to participate in that. And I totally agree that there are several topics. Please, if you have any suggestions as to the breakdown of the topics that we need to, send it to me by email, and we'll discuss that with the planning committee. And Travis, and we'll get back to you with your team on that, and then we would go further with would look at what other teams we're going to form in terms of this discussion. But If there's no announcement and nothing too critical, I would like to thank all of you for coming for the meeting and for your contributions. I think this is so important that we're able to meet and have this discussion. So thank you so much for coming for the meeting, and I hope to see you again soon, hopefully face to face.
Thanks.
Bye-bye.
Bye, everybody.
Thank you.
Bye.
Thank you.
Thank you. Bye all.
Bye.